Hi, this is Dr. Surapaneni. Topic for today is sinusitis. You're looking at a pictorial representation of our sinuses. We have four paranasal sinuses. The frontal sinus, which is localized to the top of the forehead, above your eyes. Behind the nose, you have the sphenoid sinus, which is more deeper in the skull, and then you have the ethmoid sinus, which is next to the nose, between the eye and the nose. And then you see the maxillary sinus, which is behind the cheekbones. Note these sinuses are named after the bone that makes up the sinus cavity. Sinus cavities are lined with cilia, which help with mucus clearance. The mucosa in a sinus cavity is consistent with the same mucosa you find in a nasal cavity. Usually sinuses drain mucus directly into the nasal cavity. And when this mucus drainage is blocked or is interrupted, you can have sinuses that are filled with mucus, which can cause inflammation and thereafter a superimposed infection. Bacteria. Sinuses, which are air-filled cavities, act as shock absorbers. These cavities produce mucus, which moisturizes our nasal passages, prevents contamination with bacteria, viruses, pollutants, allergens, ultimately protecting our respiratory tract. They also function to humidify inhaled air, making it easier to breathe. Some other functionalities of these sinuses are thought to be associated with making your voice louder and also making your skull feel lighter, which could be as part of the evolutionary chain of human evolution, as you can compare bones which are more spongy and dense in chimpanzees and lighter as we evolve into humans. A simple way to understand sinusitis is to really attribute poor clearance of mucus in your sinuses, which are just basically air-filled cavities in your skull. When mucus gets trapped, it leads to superimposed infection, like a bacterial infection, and then along with severe inflammation of these sinuses. Common terminology used in clinical practice to define sinusitis include acute sinusitis, which is basically symptoms less than 4 weeks, subacute sinusitis, usually ranging between 1 to 2 months, chronic sinusitis, usually symptoms persisting beyond 2 months, recurrent sinusitis, which includes episodes of acute sinusitis at least 3 or more times in a year. A common presentation of sinus infection includes facial pain over maxillary sinuses or over your cheekbones, forehead, over your glabella, right above the nasal bridge, earache, one or both sides, headache, nasal stuffiness, drainage from your nose, could be thick green snot, toothache, cough due to postnasal drip, bad breath, low-grade fever. A doctor can correlate based on your pain around your sinuses to what sinus could potentially be causing your pain and infection. Usually pain around your forehead, right above the nasal bridge, could be suggestive of frontal sinusitis. Pain over your cheekbones could be suggestive of maxillary sinusitis. Pain around or behind the eye, the orbital bone, could be a sign of ethmoid sinusitis. And somewhat atypical, but symptoms of headache, pain radiating to the neck and ears could be a sign of sphenoid sinusitis. So who gets sinusitis? Some common associated risk factors include people who suffer from allergies, who are chronically suffering from allergic rhinitis, or babies that are born with anatomical defects like choanal atresia, which is basically a blockage of the nasal passage that goes into your nasopharynx, so they can't effectively drain secretions. Also, patients who are immunocompromised, who are going through chemo, patients who have immunodeficiencies, and patients who have known history of trauma affecting their sinuses. Imaging is the gold standard for diagnosing sinusitis. By doing a CAT scan of the paranasal sinuses, we can effectively diagnose someone with sinusitis, visualizing the anatomy and looking at the differences between the normal and abnormal sinuses. Here you see a red arrow pointing at the maxillary sinus on the right side, which clearly shows a sinus that's filled with mucus. An ENT doctor or a radiologist can accurately diagnose you with local infection in your sinuses by identifying air fluid levels. They can identify anatomical defects like mucus retention cysts, more commonly noted in maxillary sinuses. Usually CAT scans are very helpful in patients who have recurrent disease or planning to undergo elective surgery for correction of anatomy. Treatment of sinusitis can consist of rinsing the nasal cavity with neti pot or a saline rinse, nasal spray, over-the-counter cold medications like Tylenol Cold, Dayquil, NyQuil, antibiotics like Augmentin, cefuroxime, Bactrim, massaging your face, making sure you're mobile and sleeping on 2 pillows, drinking plenty of fluids, and resting. Unfortunately, when patients fail to respond to conservative treatment and they have persistent disease, usually chronic sinusitis greater than 2 months, these patients may need add-on therapy with prednisone or steroids, possibly even extending the duration of antibiotics, and trial with intranasal steroid sprays like Flonase, Nasonex, etc. It's important to involve ENT doctors in chronic sinus care due to risks involved with poor control of chronic sinusitis, which can lead to nasal polyps. Often these patients will require endoscopic evaluation and treatments, sometimes even open surgeries. You need to know a relationship with aspirin, where patients have sensitivity to aspirin and non-steroidal drugs. These type of patients can have an exaggerated response to sinus infections. Therefore, treating them in the form of immunotherapy and desensitizing them towards aspirin is very helpful in managing their sinus care. Just remember, sinus care can be manageable with effective over-the-counter treatments in the form of saline rinse of your nasal cavities. Make sure to use distilled water when you use a neti pot, and temporary use of antibiotics during flare-up can ultimately help you get over the infection. When your disease progresses and becomes chronic, it needs to be better managed with incorporating steroids or extending your current use of antibiotics and involving ENT